Good morning. In today's session, I'm going to discuss about how to choose a hypothesis testing. Okay, so you might have come across various tests like t-test, pair t-test, Kruskal-Wallis, Mann-Whitney, Friedman's test, ANOVA, RM ANOVA, chi-square and all. Okay, so we might be wondering like how to choose the hypothesis test which we are going to use when we are writing the protocol. Okay, so in today's session we'll deal about that. Okay, so when we try to do a research, we are trying to find the truth. Okay, we are trying to investigate the truth and find the truth. Okay, so to find the truth, we select a study design, we do the study, and then we collect some data. From the data, we do some kind of analysis. Okay, so there are two components of statistical analysis, which is summary statistics or descriptive statistics and the inferential statistics. We'll see what is summary and inferential statistics. Okay, most of the times when we try to do a study, we won't be able to take the whole of the reference population. Okay, so we will be taking a sample from the reference population and then we collect the data from the sample and then we try to do the analysis for in this sample. Okay, so try the analysis of the sample data is known as descriptive statistics or summary statistics. Okay, and from the data analysis of the sample, conclusions based on the sample, we try to generalize or extrapolate to the reference population from which the sample is taken. Okay, so this extrapolation is known as inferential statistics. We try to get some inference about the reference population from the sample we have collected. Okay, so that's why it is inferential statistics. Okay, how are we going to do the inferential statistics? So there are two components, confidence interval and hypothesis testing. Okay, confidence interval will be done separately in another session in detail. So in today's session, we will be dealing with hypothesis testing. Okay, so we'll see what is a hypothesis testing. So basically, a hypothesis test is a statistical method that uses the sample data to evaluate a hypothesis about a population. Okay, so we need to know what is a hypothesis. So a research hypothesis is a priori written statement that predicts the relationship between the variables in the study, which can be tested. Okay, so it basically tries to answer the research question which we are trying to find. Okay, so there are few characteristics of a research hypothesis. First is it should be clear. Okay, it should clearly mention what is the exposure variable, what is the outcome variable, and whether we are trying to find any association or not. Okay, the second is to specify the direction. Okay, what do we mean by direction? If we say two variables are associated, okay, smoking is associated with lung cancer. Okay, it can either increase the lung cancer or smoking can either decrease the lung cancer. Okay, increase or decrease is the direction which we are trying to mention in the hypothesis. Okay, if we mention that it increases the outcome or decreases the outcome, then it is one-sided hypothesis. Okay, if it doesn't mention whether it is going to exposure is going to increase or decrease the association, then it is two-sided hypothesis. Okay, so an example for two-sided hypothesis is smoking is associated with lung cancer. Okay, if it has to be a one-side hypothesis, then it will be smoking increases the lung cancer risk. Okay, so that is the direction, specification of direction in a hypothesis. The third component is any hypothesis should be testable. Okay, so we will see that with an example. Okay, so we are going to do a study, okay, in which among MDR TB patient, we are trying to find whether low BMI is associated with unsuccessful treatment outcome. Okay, so here MDR TB patients are our study population. Okay, and low BMI is our exposure variable and unsuccessful treatment outcomes are or outcome variable or dependent variable. Okay, so in this situation, if we want to give a null hypothesis, okay, null hypothesis always mentions there is no association. So here the null hypothesis will be low BMI is not associated with unsuccessful treatment outcomes. Okay, so what can be the alternate hypothesis? low BMI is associated with unsuccessful treatment outcomes. Okay, so you need to notice a point here, okay, which whether it is two-sided or one-sided. Okay, it doesn't mention whether low BMI increases or decreases the unsuccessful treatment outcome. So it is a two-sided hypothesis. Okay, if it mentions that low BMI increases unsuccessful treatment outcome, then it becomes directional or one-sided hypothesis. Okay, when we do a hypothesis test, we try to find the p-value, and if p-value is less than 0.05, then we reject null hypothesis and accept alternate hypothesis. That's what we mean by statistical significant association. Okay, so we'll see what is a p-value and what is the significance of it, how important it is, how to take inference from it. Okay, all these things in a separate session. So in today's session, we will be dealing about how to choose a hypothesis test. Okay. Okay, when we try to choose a hypothesis test, okay, first thing we know to know is what is the type of the outcome variable. Okay, so it can be either categorical or continuous. We'll see it with example. Okay, suppose if you want to find the association between smoking and lung cancer is the outcome variable. Okay, and lung cancer can be present or absent. Okay, so there are two categories and it is a categorical variable. So this is an example of a categorical outcome variable. Okay, so now we'll see another example in which we try to find association between obesity and systolic blood pressure. So here systolic blood pressure is expressed in mmHg, which is a continuous variable. Okay, so this is how we choose what is the type of outcome variable. Okay, so we'll see how to choose the statistical test for categorical variable first, because it is very easy and simple. Okay, so if the outcome variable is categorical, for example, the outcome variable is yes or no, two categories, alive or dead, two categories, or the disease present or absent. Okay, if the outcome variable is categorical variable, then we are going to use we are going to see whether the groups are independent. Okay, if there are the groups are independent, then we will use chi-square test. Just remember categorical C with the chi-square C. Okay, if the outcome variable is categorical, we will, and the independent groups are there, then we will use chi-square test. Okay, when we try to do any hypothesis testing, there will be few assumptions. Okay, if the assumptions are not satisfied, then we'll have to use other alternative test for that particular situation. Okay, so if the chi-square test assumptions are not followed, then if it is a 2 by 2 table, we'll use Fisher's exact test. What do we mean by 2 by 2 table now? Okay, suppose in this example, smoking causes lung cancer. Okay, there are two categories, smokers and non-smokers in the exposure variable, and there are two categories in the outcome variable. So basically 2 by 2 means the number of categories in the exposure variable and the number of categories in the outcome variable. Okay, so if the number of categories are 2 and 2 in our exposure and outcome variable, then it is 2 by 2 table. Okay, if either the exposure variable or outcome variable has more than 2 categories, then we will use likelihood ratio chi-square test. Okay, to simplify, I am just going to repeat it. If the outcome variable is categorical and independent groups are there, then we will use chi-square test. Okay, and if chi-square test assumptions are not satisfied, then we will see whether it is 2 by 2 table or not. If it is 2 by 2 table, we will use Fisher's exact test. And if it is not a 2 by 2 table, then we will use likelihood ratio chi-square test. It's just a variation of chi-square test. Okay, if the outcome variable is categorical variable and there is related groups, before and after groups, or matched studies, in matched studies, okay, we will use McNemer chi-square test. But one thing we need to notice here is McNemer chi-square test will be used again only for 2 by 2 table. Okay, so that is about the categorical variable. If our outcome variable is a continuous variable, then we need to ask the next question, what is the number of groups, whether it is 2 or 3 or more. Okay, and then we need to ask another question, which is whether the groups are independent or the groups are dependent. Okay, and then we'll have to also have a check on what are the assumptions for doing this test, parametric test. Usually the outcome variable should follow normal distribution. That will be the important assumption when we try to choose the test. Okay, so these 4 questions we need to check before choosing the test. Okay, so if the outcome variable is continuous variable and there are 2 independent groups, what do we mean by independent groups? Okay, so if you want to find the association between systolic blood pressure and gender, okay, so there are male and female genders. There are 2 categories. So male is an independent group, female is an independent group, and there are 2 independent groups. Okay, so the outcome variable is continuous and there are 2 independent groups. Then we will use independent t-test or student t-test. Okay, both the tests are just different names for the same test. Okay, and there are few assumptions to do this t-test, independent t-test. If the assumptions are not satisfied, then we will use the corresponding non-parametric test, which is Mann-Whitney test or Wilcoxon-Ransom test. Okay, now the outcome variable is continuous, the number of group is 2 and the groups are related groups. What do we mean by related groups? It is before and after type of data. Okay, suppose if we want to give an intervention X to check the blood pressure, whether the intervention is going to decrease the blood pressure. Okay, we'll check the baseline BP. Okay, and then we'll check the end line systolic blood pressure. Okay, and then we'll try to say whether how baseline BP is significantly different from the end line BP in the same people before and after study. Okay, so in this situation, we will use paired t-test again if the assumptions are satisfied. If the assumptions are not satisfied, then we will use corresponding test, which is Wilcoxon signed rank test. Okay. Now, if the outcome variable is continuous and the number of groups are 3 or more, okay, independent groups, then we will use ANOVA. ANOVA means analysis of variance. Again, if the assumptions are satisfied. If the assumptions are not satisfied, then we will use Kruskal-Wallis test. Okay, for 3 or more groups and related groups, okay, we'll use RM ANOVA, repeated measures ANOVA. Okay, if the assumptions are satisfied. If the assumptions are not satisfied, the corresponding non-parametric test will be Friedman test. In SPSS, it is known as related K sample test, which K being the number of samples, number of groups. Okay, so this is how we choose a hypothesis test. First, we need to check what is the type of the outcome variable. If the outcome variable is categorical and independent groups, we'll use chi-square test if the assumptions are satisfied. If the assumptions are not satisfied, then if it is 2 by 2 table, we'll use Becher's exact test. If it is not 2 by 2 table, we'll use likelihood ratio chi-square test. Okay, if the outcome variable is categorical and the groups are related like matched studies or pre and post type of studies, then we will use McNemer chi-square test. Okay, if the outcome variable is categorical, if the number of groups is 2 and independent groups, we'll use independent t-test or student t-test if the assumptions are satisfied. If the assumptions are not satisfied, then we will use Mann-Whitney U-test or Wilcoxon-Ransom test. Okay, if 2 related groups, dependent groups are there, then we will use paired t-test. If the assumptions are not satisfied for paired t-test, then we will use Wilcoxon signed rank test. Okay, if there are 3 or more groups, independent groups, then we'll use ANOVA. If the assumptions are not satisfied, then we'll use Kruskal-Wallis test. 3 or more dependent groups, then we will use RM ANOVA. If the assumptions are not satisfied, then we will use Friedman's test. Okay, so I'll just give an example about for 3 or more independent groups. Suppose we want to find the association between obesity, which has 3 categories: underweight, normal, and overweight. Okay, so there are 3 groups, independent groups, and we want to check the association of obesity with systolic blood pressure, which is a continuous variable. Okay, so if systolic blood pressure follows normal distribution, it follows the assumption, satisfies the assumption, then we'll use ANOVA. If it doesn't satisfy the assumption, we'll use Kruskal-Wallis test. Okay, similarly, for RM ANOVA, the example can be, suppose during the anesthesia related studies, usually they will give an intervention, they will give a drug, and then they will check the baseline BP, and then they will repeat it again and again. Okay, suppose after 10 minutes of taking the IV drug, and then after 30 minutes of taking the drug, after 2 hours. Okay, so now 4 times they are checking the BP. Okay, so first group, second group, third group, and fourth group. Baseline 10 minutes, 30 minutes, and 2 hours. So now we have 4 groups, and these 4 groups are related because it is before and after in the same population. Okay, so in this situation we will use RM ANOVA. If it follows the assumption. If it doesn't follow the assumption, then we will use Friedman's test. Okay, so this is how we choose a hypothesis test. Okay, thank you.